talked a little bit about that value-based payment system, and can you kind of expand on that and let us know a little bit about what it means to manage a family practice around that value-based system, because that is a shift from that fee-for-service mentality. So
correct. And it's, you know, it's hard right now, and I think that's one of the hardest things I have as a champion of patient-centered medical home is, you know, we're still in a model where we have to see a lot of patients in order to get through our day and to get the to raise the incomes that we need. But we're seeing a movement. You know, we're seeing, okay, well, if we can get all of our, let's say we take a population like diabetes and our diabetic patients, there are insurers that are starting to say, okay, well, if you can show us that your A1Cs are below a certain point and that everyone's getting their eye exam done and that their foot exams are done and that you're checking their lipids on an annual basis, we're starting to see them start to put a little bit of money towards us. And that is sort of just the tip of the iceberg of like, all right, if we can prove that we do this care, they're willing to give us money to show we're managing these chronic conditions better. And we're then able to take that money and put it into care coordination and helping our nurses become care managers. And then with that, hopefully we can expand to things like better hypertension management and better congestive heart failure management. So we're seeing where as we manage a population better, we get some money for that, which then allows us to expand the populations of patients that we're able to manage with this value-based or sorry, I have to
yeah,
cut
it's
that out.
value-based.
Yeah, value-based
payment system,
exactly.
Yeah.
So it's in the long run, what I see is if I could then see less patients but spend more time with each patient and be able to maybe be getting paid, because even though I'm not seeing that patient in my office, but my nurse has made a phone call to them that day and checked their weight and helped me adjust the dose of their diuretic possibly, we still have payment for that because technically we're helping that CHF patient manage their CHF. They're not having to come in. We're not seeing them like we would in a fee-for-service model. We're not just bringing them in for a weight check and I walk in and just say hello and just so we can check off a box and say, yeah, we saw them today. We're getting payment for the fact that we're just taking care of them, whether they're here, at home, wherever else they are in our healthcare system.
Mm-hmm. And you're able to provide alternative types of encounters versus just an in-office visit that way as well.
Correct, exactly, thank you.